Destination Medicine is a collaborative initiative of regional training hubs. With first-hand lessons learned from those who have gone before, this podcast is designed to assist and inspire anyone interested in pursuing a medical career in rural and regional Australia. Welcome to Destination Medicine. I'm Peter Letts. Soaring to the heights of rural and remote medicine, and not just in RFDS planes, Dr. Jessica Martyn has enjoyed an extremely varied and exciting career. A passionate advocate of living and working in rural Australia, she now runs the emergency department at Port Augusta Hospital in South Australia. Jess says she brings a huge amount of hands-on experience to also being a flying doctor, inspired by the influence of her father. She starts by explaining to Nicole Goodman how the apple didn't fall far from the tree.
Yeah, so Dad was an emergency search and rescue helicopter pilot, meaning that if somebody rolled their car, he'd land on the highway. If a boat overturned down south of Perth, he'd winch them up out of the water. Or if a hiker fell down a cliff and broke their leg. So yeah, an amazing career that he had, and definitely an influence on what I end up deciding to do.
Yeah, wow. So medicine outside of your dad's influence, was that always something that you thought you would go with as a career?
No, so I wanted to be a vet purely because, as every little kid does, they like animals, and science at school was always pretty cool. When it got to the crunch end of high school, the entrance marks on your final exams were pretty similar for vet and medicine. And I didn't get into vet, but I got into medicine. So went up to James Cook Uni in Townsville as my first preference, because pretty early on you got to do clinical placements, whereas my local uni, I don't think you got to touch a patient until you're more than halfway through your studies.
So did the degree allow you to have more of a hands-on experience early in your medical studies?
Yeah, it did. So James Cook Uni meant that at the end of your first semester, you got to do a clinical placement. So you're 6 months into a medical degree. You've got no idea about anything. And I managed to do that in the emergency department at our sort of local hospital where I grew up near Perth. And it was amazing. I think they just sort of parked us in the resus bay and said, all right, stand up against the wall, you can look, but don't touch type of thing. And it was just amazing. It was like having this front-on view of what I thought the TV shows all looked like, and that it was great. And as soon as they were doing anything fun, they were like, all right, we're going to go stick a big needle in someone's knee. Come and watch. And I was like, okay, wicked. And then, yeah, it was definitely influential in wanting to do emergency medicine. And then I'd go home and, Dad would say, oh, how was your first day of placement today? And, oh, Dad, it was wicked. Somebody's heart stopped and I got to do compressions. And Dad would go, oh, I don't really know if that's wicked. But because of his background working as a search and rescue pilot, he actually knew a bit about the medical thing. So, yeah, it was pretty cool. Pretty cool as an 18-year-old 6 months into a medical degree.
Oh, absolutely. And it would have been really good to bounce those experiences off with your dad.
Yeah. And even sort of more recently, loading anaesthetic, pop the tube in the throat, and there's two places it can go, down into your lungs or into your stomach. And if you get the stomach, not a lot happens breathing wise, but I was trying to explain it to Dad that, oh yeah, I got it first go, Dad, straight into the breathing tube. And Dad goes, oh yeah, intubating, that's easy. Like I've helped with that a million times. So it's hard to impress, but it's definitely nice being able to say I did this today and being brought back to ground zero.
Yeah. He sets the benchmark.
Yep, still does.
Now, you also found a love for regional and rural medicine. Did this come from the various placements that you did throughout university studies?
Yeah, most definitely. So I sort of grew up about an hour and a bit east of Perth in a little town called Gidgegunnup, which is near 2J, and very much so didn't know really what specialty I wanted to do, but I knew I didn't want to work in the city. So all of my elective placements throughout uni, as well as the mandatory ones, were quite sort of regional as well as rural. So in second year, again, nothing, still went to Dorrigo, which is just inland of Coffs Harbour. And there was this amazing doctor there that ran a GP clinic during the day and then managed Dorrigo Hospital after hours and during the day for emergencies. And he just was the absolute epitome of the jack of all trades, to the extent that he'd take his own x-rays, develop the x-ray films like in the dark room with the different chemicals, and then treat the fracture. And he just had a family as well that were living in Dorrigo full time. Like, he just was such an instrumental person that helped me develop my love for regional and rural medicine. Working in Longreach in central Queensland as then a fourth year, again, just working with amazing people, both doctors and nurses and paramedics and administrative support staff and allied health, and just everyone, the people you meet, and just the attitude, okay, let's get it done together with the resources that we can. It just was such a hands-on experience. And I was talking to my colleagues that had gone to different universities in capital cities, and they had also had some amazing experiences, but it was far less hands-on compared to what I was experiencing. And I think that's still relevant today with our medical students and our junior doctors. That's definitely the feedback we get from them when they're discussing with their more sort of capital city-based peers.
Yeah, I hear that a lot, that there's more scope for work and getting your hands dirty, dare I say, more so than in the metro areas. So that absolutely makes sense. Would you say then that it was the opportunities that you had in your 5th and 6th year that really set the passion for rural and regional medicine?
Yeah, most definitely. So I was very happy in North Queensland, where I was at the moment, and there was a certain number of students that were given the opportunity to do their last 2 years of their medical degree up in Darwin. And to be honest, I wasn't really keen to move initially, just because I had developed good ties in North Queensland and I had horses, and it was a bit of a move to head a bit further north. Of course, horses don't do well in the wet season in Darwin, so I had to say goodbye to them. So it was a bit apprehensive starting, but it just straight away we went into this 3 or 4 day cultural immersion weekend, and I wasn't really keen on that because I'd been fortunate enough to do quite a lot of cultural work already with our First Nations population through North Queensland and sort of just through the uni. But we went out to Gallowinku, which is quite an isolated community that's beautiful, and just the presentations and the time we got to spend with some of the Indigenous elders and the Nunkari, which is traditional sort of medicine doctors, was just something even to this day I still recall very fondly. And with that was some sort of rural generalist consultant doctors that were explaining, I suppose, the more Western model of healthcare and just the differences in frequency and severity of diseases that we often don't realise are in Australia. So that includes things like scabies, tuberculosis, shocking diabetes, melioidosis, rheumatic heart disease, like things that aren't common elsewhere in Australia. So from Darwin, I did my first 2 years as a qualified doctor in Alice Springs, which was even more brilliant, sort of similar sort of chronic disease and without so much of the tropical disease, obviously, being in Central Australia. But the road trauma was something that really concreted my interest in trauma, that back then there was an open speed limit as soon as you got about 50 k's south of Darwin. So we were seeing 10 people in a single vehicle hitting a camel at 150 kilometres an hour. Yeah, so just the exposure was obviously horrific for families involved in these accidents. But as a junior doctor, not only it was eye-opening, but again, just the education opportunities. And because of these traumas, there was a lot of procedures. So there's not too many other places in the country where you learn how to do things like central lines as a junior doctor, or sort of chest drains in a very supportive, positive learning environment. So I'm very, very fortunate for those early doctor years in Alice Springs, and I hope to get back there one day.
Yeah, right. It's fascinating how you take the good with the bad, I guess. That exposure is so beneficial, but gee, you would have seen some horrific things. Tell me, what about outside of work? Just, enjoying life. What's it like doing that regionally?
Obviously very biased, but it's way better than living in the city. Even little things like you finish a shift late in ED and you've got to drive home, rather than saying, watch out for red lights or watch out for speeding things, it's always, all right, watch out for the roos. Oh yeah, they were really bad the other day, or the rain's brought them in. Like, it's just a bit different. And definitely I think I've got 2 traffic lights on the way to work. Peak hours just before school drop off for about 10 minutes. Yeah, it's great. You're sort of fortunate. I've got a couple of different roles in town, which means I've got different sets of work colleagues. The sort of social life with that is fantastic. And we've got got the Flinders Ranges on our doorstep, as well as the Spencer Gulf. So we get the mountains for hiking and four-wheel driving and camping. We get the water for fishing and kayaking. Yeah, very spoilt here. We don't have a huge array of coffee shops and gin bars and nightclubs and cinemas, but very happy to forego those things to be able to live regionally. I don't know. I'd bias against the city, so I'm probably not the most accurate person to chat to about it.
Not at all. I mean, these are the benefits, absolutely. You forego the cafe lattes for an open, natural experience in nature. It's absolutely gorgeous. And kind of on that topic, I guess, you also spent some time in the army. What was that like?
Yeah, so I did my time after completing my first 2 years as a doctor. So that was part of the undergraduate medical scheme. So basically, Defence Force contributed towards my uni fees as well as financially some assistance to study. And then I had a return of service arrangement, which is when you go and work for them. And that it was interesting. There was a few really cool highlights. I remember hanging out of an MRH 90 helicopter over the Whitsundays doing tactical manoeuvres. I have no idea why they needed a doctor as part of the crew, but that was pretty awesome. Been to Iraq, sort of East Indonesia and East Timor, doing some training and peacekeeping, and that they were quite, even sort of Iraq was obviously combat, but the other two just quite austere environments, and that there was no running water and there was no electricity. So even practical things like how do you manage a gastro outbreak without running water definitely gave you an increased appreciation of the logistics of trying to do pre-hospital healthcare. There was a lot of time in the Army barracks clinics and a lot of occupational medicine, sort of pre-deployment, post-deployment, change of corps, medicals, which is not my strong interest or forte, and a lot of very basic primary healthcare, looking after essentially young, fit men that overdo it in the gym quite regularly. So yeah, an interesting 3 years, and I am grateful for my time in the Defence Force, particularly with the exposure to pre-hospital care, but not quite the emergency medicine and critical care medicine job that it was initially advertised as. So much happier and have a lot more career satisfaction with where I've ended up.
Absolutely. And what a career it's been. Plus, on top of all of that, you also work for the Royal Flying Doctor Service based in Port Augusta. Tell us a little bit more about that.
Yeah, so Port Augusta, where I live, is just about 4 hours drive north of Adelaide. So we're really a good distance in that road ambulance transfers can't drive 4 hours down to Adelaide and 4 hours back. That would take out obviously an ambulance crew for an entire shift. So for anyone that is too sick to stay at Port Augusta Hospital or needs tertiary level specialist care, goes down on a Royal Flying Doctor Service plane with our higher acuity patients go with another retrieval organisation, MedStar with. So I had about 6 months left of GP training time to do after finishing with the Army, and wasn't keen to go into your sort of more traditional, I suppose, GP practices, seeing 4 patients an hour, having to make really quick clinical decisions and feeling the associated pressures with that. So I started working for the Royal Flying Doctor Service doing primary healthcare clinics and some on-call work for emergency, and it's just the best primary healthcare I think you could do in the country, if not further afield. So flying out to stations, small Aboriginal communities such as Oodnadatta and Oak Valley, doing primary healthcare, treating any emergencies that walked in, and being on call for kids falling off windmills, musterers falling off motorbikes, men having heart attacks in the middle of nowhere, cars getting rolled in the middle of nowhere. It's a very satisfying job in that people are always happy to see you, where the doctor sits in the plane just happens to be closest to the passenger door. So by default, you're usually the one that opens it. And just like even now, sort of more than 5 years later, you just get this little sort of, there's really a buzz of appreciation, I guess, that you open the door and people just that classic, oh my gosh, like, thank you for coming. We're so happy to see you. So it's a very humbling job, and to be able to provide that healthcare for our remote Australians is such a privilege, and one that I think continue to do for as long as possible.
And if working for the Royal Flying Doctor Service doesn't keep you busy enough, you're also the head of the Port Augusta Hospital Emergency Department. I don't know where you find time for all of these things, but can you tell us a bit about that role as well?
Yeah, so Port Augusta Hospital is the third largest regional hospital in South Australia and quite a busy hospital. It's got the local paediatric department as well as obstetrics and gynae, general surgery and general medicine. So we sort of get patients from a much broader area as well. So we see everything that walks in the door. There's quite a high burden, what we deem chronic disease in our community, meaning people that have got things like high blood pressure and diabetes, and due to lots of different socioeconomic and logistical factors, often the control of that chronic disease isn't quite optimised. So people are getting quite sick just from their blood pressure and diabetes and that. Port Augusta is also often referred to as the crossroads of Australia. If you want to go north to Darwin, you go through Port Augusta, south to Adelaide. If you go west across to Perth or east across the eastern states, you'll pass through Port Augusta. So as a result of that, we see quite a lot of road traffic accidents, so sort of high-speed rollovers and people falling asleep at the wheel and that. So quite a lot of trauma comes through. We're the receiving hospital for a lot of our smaller regional hospitals in the area, as well as we've obviously got the Royal Flying Doctor Service base, so patients that are medically suitable to come to Port Augusta get flown in from stations and properties and tiny little towns. And we've also got the largest prison in South Australia just out of Port Augusta. So we've got some special populations like our prison population too.
I wonder, along your journey, you would have come across many health professionals and mentors. Has there been any advice that stayed with you throughout your journey that you've kept as a bit of a North Star?
It's definitely something I pass on to my more junior colleagues. And I suppose that would be that your job as a student or a junior doctor is to learn and be safe. Like sometimes I think we unintentionally put a lot of pressure on our more junior colleagues that they should be as time efficient and as thorough as perhaps we now are, even though we might have an extra 5, 10, 15 years of experience. I think we can on occasion forget that we were once students and juniors as well. So I always sort of say, like, your job is to learn and enjoy yourself, and you won't realise that is all we want you to do until you're 5 years down the track further yourself. Like, for example, when we have a medical student in ED, we try and get them to do every single cannula, a drip that comes through the door, and they're often a bit apprehensive and they say, oh, look, I'm not very good at them. And I said, of course you're not very good at them. How many have you done? And they said, oh, I've done 10. I said, well, you're going to be a lot better after 50. You're going to be pretty good after 100. You're going to be excellent after 1,000, and you're going to be a master after 10,000. So just sort of say, like, you just need to enjoy yourself and learn and be safe. And it's absolutely okay to say when you're not feeling safe and get somebody that's got a bit more experience to guide you and help you. And I think the more you ask to be able to even just observe, like being sort of proactive in any opportunities, just sets you up for later down the track. And it does feel as though, like, I can still remember my first day as a doctor was, as a qualified doctor, was at the Alice Springs Hospital intensive care unit. And the registrar was lovely. And he said, do you want to learn how to do an arterial line, which is when you pop a sort of drip basically into an artery and you get a beat-to-beat blood pressure, which most of our ICU patients have. And I was like, oh my gosh, I've never even seen one, let alone done one. And within 2 weeks, I was doing them all. So I'd often sort of use that analogy as well.
Yeah, it's a really good insight and really good lesson, as you say, to keep learning and to be safe and just say yes. That's what I hear a lot too. Just say yes and take every opportunity. Jess, you've been fortunate enough to work across so many environments in your medical career. What does the future look like for you?
I wish I had a crystal ball and I could tell you. I'm at the very sort of fortunate and privileged stage at the moment that lots of doors seem to be opening up at the moment, and I'm not sure. I do know that I want to be in Port Augusta for at least the next sort of foreseeable future because I love all of my jobs and there's still so much more to learn and sort of self-improvement and knowledge that I think I can both pass on to some of my peers and learn from my peers as well. I think the really long-term goals is hopefully sort of contributing towards more of a centre of excellence for our medical student and junior doctor training in our local region. And different to that, but sort of along the same train of education, and that would be doing some overseas aid work with some of my colleagues have had significant contributions to setting up training universities in developing countries, and I look forward to perhaps being able to work for them.
Dr. Jessica Martyn, Head of Unit at the Port Augusta Hospital Emergency Department at Flinders and Upper North Local Health Network in South Australia. This is Destination Medicine. Thanks for listening. Regional training hubs are supported by funding from the Australian Government under the Rural Health Multidisciplinary Training Program.